Hi, I'm Dr. Stephen Fine for the New York State Clinical Education Initiative for PrEP Aware Week. Today I'm going to talk about stopping PrEP. Sometimes people on PrEP stop for a variety of reasons. One of the reasons people often give is they didn't feel like they were at risk for HIV anymore. Before you stop PrEP, you should always discuss it with your provider, who can help you assess your risk. Some people feel they're not at risk because they don't have a lot of sex partners. Well, that's actually only part of the risk. Another part of the risk that you may not take into account is the rate of HIV positivity in your community. So there are some places where more people are HIV positive than in others. And that actually affects your risk despite the number of partners that you may have. Of course, the more partners you have, the more risk you may be taking. But if the rate of HIV in your community is high, you may actually have risk with only a few partners. I like to think about it as the risk of crossing the street. If you live in a rural area where there aren't very many cars, and PrEP is looking both ways, well, perhaps you're going to stop looking both ways, but you can still cross the street most of the time because there aren't very many cars. On the other hand, if you live on a very busy street and you don't look both ways even once, the chances are you may get hit. So the risk not only is the number of partners you have, but also the rate of HIV in the community. Therefore, if you're thinking about stopping PrEP, you should discuss it with your provider first so you can assess the risks together. There are other ways to take PrEP, for example, on-demand PrEP, which you can take just before and after you have sex, in case you don't have that often and don't want to take a pill every day. Also coming soon is a really exciting option for an injectable form of PrEP that you could take much less frequently and not need to take a pill every day. So keep your eyes open for that. Thanks for listening. I'm Stephen Fine with the Clinical Education Initiative of New York State.